You may have not heard of fibroid tumors, but about 80 women out of 100 have them. In most cases, these non-cancerous tumors are harmless, but in some cases, like Lisa Gutierrez, they're not only uncomfortable, but unbearable.
I had a pain in my, lower right abdomen. I started having, heavy periods, extremely heavy periods, especially the first day. My stomach was sticking out. I was moody and tired.
Lisa suffered with these symptoms every month until she decided she just couldn't live this way. A visit to her doctor revealed that her symptoms were not related to her regular menstrual cycle, but instead she had fibroid tumors.
About 2/3 of all women have fibroids, and it's particularly common in African American women. And people who have fibroids very often have multiple fibroids. The thing with fibroids is that most people aren't symptomatic of fibroids, so you may have it and never know you have it.
In fact, most women don't realize it. They dismiss the symptoms as being part of their regular cycle and all the negatives that go with it. But it doesn't have to be that way. Fibroid tumors can now be treated in a safe, fast manner, but it hadn't always been that way.
My mom had the hysterectomy and she was done with her childbearing years. So me being 32, I still have not had any children and wanted to have the option of, having children. So then that's when I kind of started to do the research on the different types of surgeries that were offered.
Her research brought her to Eden Medical Center and Dr. Joseph, who told her about a procedure called uterine fibroid embolization, or UFE.
Most women who have fibroids don't have a solitary fibroid. They usually have several fibroids, and it's always hard to tell which fibroid is actually the culprit that's causing the bleeding or the pain. So taking one out may or may not resolve your symptoms. So then, of course, the embolization came about, uterine fibroid embolization, which basically circumvents all these things because you take care of all the fibroids. You're basically cutting off the blood supply to all of the fibroids so they all shrink. So there's no guesswork to which one is the one that's causing the problem. It all causes overall shrinkage of the uterus as well as the fibroids. It's a little more, it's not such an abrupt procedure, meaning that you just don't yank the uterus out. It's maybe a little euphemistic, but a little more holistic in the sense that your body's basically taking care of it. It shrinks because the blood supply has been cut off to it, so it doesn't resolve the fibroid mass effect right away. It could take several months for the fibroid to shrink, but the symptoms of bleeding and cramping are usually resolved immediately.
For Lisa, UFE was the right choice. She got her life back to normal in a matter of weeks instead of months.
It was basically an internal healing. It's kind of like in one day, I think I was at the hospital for 23 hours, and then I went home. For about maybe a week, I had severe cramping, and then the following week, I was pretty much back at work.
Now, a lot of women are surprised that they have fibroid tumors and that they are so common. How does a woman know that she actually might have these?
Well, like he said, a lot of fibroid tumors are asymptomatic. So most women will never know they have it because they won't have problems. But when they do, the most common symptoms are heavy prolonged bleeding, the bulk effect, which he mentioned, which causes pelvic pain and pressure, as well as reproductive dysfunction.
Okay. And what happens if you have a fibroid and you don't do anything about it? Is it dangerous? Is it going to spread?
Well, if it's not causing any symptoms, you don't have to do anything about it. Now, if it's causing symptoms, for example, if it's causing heavy prolonged bleeding, that can lead to anemia, and that could be life-threatening. If it's causing the bulk effect, pelvic pain, pressure, that can cause urinary obstruction sometimes, or urinary frequency, which is the exact opposite. With reproduction, it actually causes 1% to 2% of all infertility cases.
Wow.
Or if you do get pregnant, it can increase your risk of bleeding in your first trimester, as well as increase your risk of miscarriages.
Is this again something like, is it hereditary?
It is, very much so.
Really? So if your mom has it, you're more likely?
Yes.
Okay, so something to keep in mind. Now, they talked about fixing the fibroids a little bit with this procedure, UFE, or the uterine fibroid embolization. Can you explain a little bit more about that? I know we touched on it, but...
Basically, what it does is, what they do is they look at the blood supply to the fibroids, and they block them. And therefore, in blocking the blood and cutting off the blood supply to those fibroids cannot continue to grow and eventually just regress.
And so it seems like it's a little bit more, the benefit of that is a little more gentle. What's the benefit of doing it that way?
Well, the benefit is significant when you compare it to either medical therapy or other surgical options. With medical therapy, that can be effective in some women, but that's usually more short-lived. Some women are excellent candidates for medications, but it's not a definitive approach. It does not last forever.
I was going to say, that brings me to the next question. What if your fibroids come back? Let's say you get them treated. Do they come back, and what happens if they do?
Yes, they do come back. And usually, you know, if you choose a surgical option where you choose to just have the fibroids removed, very, very high percentage of women will have them grow back. And therefore, while surgical therapy may be definitive, especially if you end up getting a hysterectomy, it's much more invasive than uterine fibroid embolization, higher risk of blood loss and infection, and longer hospital stays, and it takes longer time to return to normal life.
A little harsher. Just real quickly, because I know a lot of people, they hear fibroids, tumors, uterus. Is this a precursor to cancer? If you have fibroids, does that mean you're going to get uterine cancer?
No.
Well, that's a good answer.
Very, very, very few fibroids turn into cancer, much less than 0.5%.
Oh, wow. So the important thing is just if you're having symptoms, take care of it.
Correct.
Okay. Well, thank you for that answer. Stay with us. When we come back, we'll tell you how you can find out more about all of the subjects discussed today on Your Health Matters.